Yeah.
Prior to the surgery, in the lead up to the surgery, and then post-operatively, particularly in the first year. I believe that the mental health aspect is as important or more important than all of the dietary considerations put together, purely because of just how powerful our mind is in the way that we do our lives. And it's something that we feel extremely strongly about.
And I hear you, and I totally agree. But I think the shift has to come to is the role of what a psychologist's role is in a MDT, or just someone like me who's independent. Like what is our role in pre and post?
Yes. So talk us through that.
Yeah, because it's really talk a lot. I actually found a very recent study that was just done last year, surveyed a group in England to do a lot of work with psychs, and it was quite good to read it because it's just reinforced different views. And what they'd done is they'd spoken to psychologists, then they spoke to members of an MDT, so it could have been surgeons, nurses, dietitians, could have been anybody, and then the patients themselves around the role of psychology. And interestingly, the MDT group seemed to think more often that psychology's role is really it's almost like that gatekeeper idea of a screener, an assessor, and we don't believe that. The patients didn't believe that so much, and the psychologists didn't believe that, which is good because we're all shifting away from that.
Yeah.
So when I present, we talk about us not being gatekeepers. Our role, yes, we do an assessment. It's called that, but it's not to say this person should or shouldn't have surgery. We actually don't have any research
or cross.
No, and we've got no evidence to support that we can predict what someone's outcome is going to be post. So if we're not good at doing that, all we can be doing then, I think, is to prepare someone. So it's about readiness for change, readiness. Do you understand what you're doing here?
Yes.
Some people come and most have done research, but I do have some people, if I do get to see them pre, I often don't. I see most people post. Where this is sort of like, I think it's this, and this, and we're going, I don't know that you've done enough research here. You may need to ask these questions or go and ask some other people who have had it, there'll be that element. But it's also just picking up things that could interfere with the surgery being, optimized.
Yeah.
And of course we as psychologists, we do want to pick up mental health disorders, but that doesn't mean that no for surgery, because if we did that, especially, bariatric candidates, it'd be ridiculous, because we know what the proportion of people's candidates for surgery have as far as depression, anxiety.
Yeah, that's right.
Yeah, disordered eating. I mean, binge eating disorder is more common in this population than others. And imagine if we precluded all of that based on mental health, that would be no one would have the surgery. This is like giving surgery. We need to know these things, but evidence actually says that those types of mental health problems are actually, do decrease from surgery. There's been some mixed results, but another recent study that's done a lot of a meta-analysis on top of another meta-analysis has said actually for even up for 2 years, those types of disorders improve. I see that myself. But if there's disordered eating then once again, as Damien, you said, if I am an emotional eater, and that's what we really want to pick up, I pick up emotional-based eating, because the surgery is great with physiological-based eating.
Yes. Yeah.
It's changed your metabolism, right? So you don't have to white-knuckle it anymore. But if it's emotional-based eating, surgery doesn't fix that.
That's exactly right.
It dulls it down for a while, because it dulls down any form of eating when your appetite's low, and that's what I really want to spend time talking to my clients about. Because if they come back early, oh no, I'm fine, I said yes, because your appetite, you've got no appetite. It's like when you're sick, no one feels like eating.
Yeah.
But it's what are you going to do when your appetite starts to come back? So, you know, you can work around that. But then what are you going to do around cravings returning, the foods that you always went to, because as soon as you sit down in front of the television, you eat, because this is habits. We've all got those.
Yeah, we do.
How many of us have I got that habit? As soon as I thought, oh, yeah, it'd be nice to have something. So, you know, it's that or significant emotional eating. And I think that's one of the hardest as a psychologist. It's one of the hardest things to work with, this eating when I'm not even sure what my feelings are. I just know that I've turned back to food.
Yeah.
Yes.
Or, as you also said, I've lost my friend.
Yeah.
Or there's reward because it's, you know, dopamine pathways. I used to get this hit because if my mood was low, so if I've got a history of depression particularly, or anything related to low mood, and that was the pick-me-up, and now I'm not using it, that's when depression is, like, we need to know that because
that's right.
that is a risk.
Yeah.
Yeah. We know that suicidal ideation and suicide risk and returning to alcohol, whether you come back to alcohol or start using alcohol, because that becomes, we're not going to get into addiction transfer, but those things are, we need to know the flags for post. What's going to happen?
Oh, I completely agree. I was and still am and inclined towards emotional eating.
Yep.
I literally talk myself through this happened just yesterday. There was some situations and I found myself standing in the pantry for no reason except that that's where you go when you feel stressed. And I was standing there and I did my usual. Am I hungry? Am I stressed? Why am I here? And I went for a walk. I didn't go and eat. But I'm nearly 6 years post-op. And I'm still talking myself through those things.
Yeah. And how long would you say that you've eaten for emotional reasons?
I would say that probably a couple of times a week I would be inclined.
Oh, sorry, I mean historically. How far back when would you have said you first started using food for?
I started using food to calm myself. I have a very vivid memory, very traumatic memory as a young child, and I was 5.
Right. So you're 6 years post.
Yeah.
Yeah. But you're saying now I've got to undo. We're talking decades worth of. Yeah. It's not gonna change like that, because this is like, you know, the old muscle memory. You know, it's there, and I'm triggered, and I don't even know why. It's also very habitual. So, you know, you do something long enough, it becomes you've lost the original trigger. It becomes a habit as well. When you combine habits with things you've been doing, it's really hard to undo.
That's exactly right. And it's not a quick, like, the surgery did not fix that.
No, and that's why when people say, oh, this is an easy way out, oh my God, no.
No. It gives us that window of time and an opportunity.
Yeah.
A very wonderful opportunity, but the important work on our health and our habits, well, for me anyway, I believe that will be lifelong for me. I believe that I'll be working on that always.
It's human lifelongness, and I'm interested in goal setting as well, and you know, why do we do things against our own best interests so often? But as humans, we just do that anyway. Yeah. Let alone when, you know, you've got a stronger need, or it's a physiological and emotional need. And food is just different to everything else. No other things. And I was trying to think of all the things I usually say that people do that are, you know, not so healthy habits, if you like, for soothing oneself or changing how you feel.
Yeah.
Food is the only thing we actually need out of all of those things.
Yep.
Yeah. We need it to live.
Stop having it.
Yeah, I mean, you can stop most of the other things, and it would never make a difference to you. But food, you can't stop eating. So it's always going to be difficult.
Yeah, that's 100%.
Wow.
Yeah.
Because I think that really is what I think a lot of us, and I know I wanted it, was for the surgery to fix me.
Yeah.
And then I could be like all the mates that I grew up with and be able to eat whatever I wanted, whenever I wanted. But that's not the reality of the surgery. And, and when I realized that, I went through a time where I was like, why did I even bother having surgery? Yeah. Even though I was meeting all these other health goals, I was still like, I'm going to have to battle this for the rest of my life.
That's really, really important, because that's a really significant risk factor, as I was just saying, for regain, but also for depression. And, if someone's had suicidal ideation or suicidal history, then they're the things that we as psychologists certainly want to hear for and need to ask more specifically. And it's at that moment, it's like, why did I do this? It's still hard. And it's always going to be hard, because it's like a diet. I was listening to a podcast and it came up yesterday about this same thing, and it wasn't to do with bariatrics, but it was like anything where especially around dieting, where you've restricted for a while and you get to this goal, and then you realise it was about satisfaction. And then you realise, well, to stay here though, I have to stay still doing the same thing, taking out all the things that I liked before if I'm doing it in a typical way. I still can't go back to the things that I wanted, because this is it. So now, I can feel dissatisfied still going forward, even though I've achieved this. Do you sort of get what I'm...
Yeah.
So it always feels like I'm going to be dissatisfied.
Yes.
So then you've got to have something. That's why we've got to have other things to be building up our lives, so that, if we took a pie, thinking about my weight and doing something about my weight, or, worrying about, it's not more than
it's not the entirety
pie. Or, family and work might be over here and this pie's been like this for so long. We've got to squash that part down. So we need to fill up the rest of our lives. And for some people that's really difficult, because some of the clients either are very lonely, which is another psychological, it's a bit of a red flag, that lack of social support. I've been, thinking about this thing for so long, but now, I've had the surgery and things, but what now? Now what?
Yeah.
What else am I going to do? I don't know. I don't really have hobbies and interests, or I couldn't do the things for so long that I loved.
That's exactly right. I mean, oftentimes we're sitting in our house or in our room, and we don't feel like we can do the things that we loved. So we've given all of those things away. Our friends or whatever that used to do those things have all moved on, and here we are just sitting going, well, what do I like doing? What does interest me? And that's where it's so exciting, because you get to start to explore all of those things.
Yeah. But that's probably where interaction with a psychologist could be really useful, because sometimes it's only in that space where someone's asking questions like that, where you get to go, oh, okay, I can start to really explore that. And that's what I've been asking my clients, the ones that come after the surgery, saying, well, what brought you here, and what is good about this space? And it's being able to get asked questions that they wouldn't have thought of asking themselves before, or hadn't thought of, or just are just discovering and don't know who to talk to. Or not. Your friends and family are great for certain support, but they're not great. They're advice giving, they're judging. We'd like to think that as psychologists we could stand back a little bit from that. And just be with the person asking the difficult things, and they can share difficult things in that very safe space that you'll never be able to share. Even with your partner, you're not going to be able to, because half the time it's about relationship issues or friendships or
100%, or family.
Oh my goodness,
or like whatever it might be. It's so good to be able to unpack all of those things with somebody that isn't. And it's not that our psychologists don't care about us. We know that you do, but you don't, not living that day-to-day experience with us.
Exactly. Yeah. And the other thing, if we talk about mental health in this space, what happens, and I'm seeing now, I do a lot of work. This is where trauma starts to arise as well, because food for so long was my dampener of my emotion.
Yep.
And so I haven't had to think about what happened to me, because I've been numbed out from it for a while. And now things have changed because I've had surgery and, wow, it's very successful. I can't use food the way I was using it. And secondly, people start to notice me.
Yeah.
Oh, my God, that can be so uncomfortable, or my body's changed, and the threat of that can bring up threat in so many ways.
Oh, yeah, it does. 100%.
Yeah. So sometimes we're sort of ending up in doing sort of either trauma work of some description, even just developmental trauma, or it doesn't have to be that something really significant happened, or a single trauma, for example. It's just I do so much with that mending of relationships, or for parental neglect, and all of these things that happened to me, for me to end up with schemas that got me turning to food and using that as a way of coping with things. So that's the long-term journey. And some of my bariatric clients I've been seeing for quite a long time, and it started off with just regulating eating and getting back on to doing the things that sort of had slipped a bit.
Yeah.
So the nuts and bolts, if you like. And then working on doing much deeper work.
Yeah.
Yeah.
Wow. I know for me, the when I was pre-weight loss surgery, I felt like I'd lost my armor once the weight started coming off, and I did feel more vulnerable, and because people were noticing me more. And some people go, oh, but you're getting so many nice compliments. For me, that was a trigger as well, because it's like, well, they obviously didn't think very much of me when I was bigger, so now I'm only acceptable because I've lost this weight. And
it's a vicious.
In my head, it was just ridiculous. But it was just so hard coming to that point of being able to accept the compliment, that it wasn't a backhanded, and I found that I found talking to new people and getting a compliment or something from a new person was okay, but people that had known me for a few years, like I had one person come up and he said, oh, we've been talking about it, and I said that I'd gone from 210 kilos down to, at that point it was like 80 kilos. And he said, oh, I would have hated to have seen you when you were 210. He's like, you're doing so well now. This is amazing. And I was there thinking, who said that? I was the same then. I'm the same now. But yes, I think for me, it was learning to just accept that some people just have no clue. And
I think go on.
And it's their issue, not mine.
Oh, completely. But just on the first thing that you said there, the other thing that my clients will say to me too is, yes, the compliments come as the size changes, but the other way it can go is when weight regain happens, the failure that somebody feels like, oh my God, everyone's going to notice, or they'll say to me, I can't go back to, like we'll say, well, are you going to go and do some social theatre? Oh, I can't go back there because they saw me at my lowest and now I'm going back and I've regained. I can't
yes.
do it. So it all starts again. It's the shame and stigma is still sitting there because it's judgment. So it's like now I'm seeing myself as failed this thing, even though I'm nowhere near where I started. Yeah.
We've had people say to us, I can't go back and see my dietitian because I've put on weight. It's like, that's what they're there for, But we end up in that.
I can't see the psychologist because I haven't really worked on what
they said
last time. So they're only going to say the same thing. But again, it's don't disconnect yourself from the people that can help you.
The answer to that one is that's when you need to go back to this. That's the most thing, because what you're going to work on, and hopefully we've got it's hard because we don't want to look like the judging teacher going, oh well, I'm so disappointed in you. It's like, well, we just want to look at what got in the way. Because obviously something is happening that's preventing you from being able to do this thing. Is it a psychological? Is it physiological? Is it social because you are juggling 20 other things?
Yeah.
Is this a priority at the moment? You might not have time to be worrying about, if I've got perfect nutrition, I'm not making my own meals. Have a frozen meal. It's like,
that's right.
Regularly eating, not letting yourself get hungry.
I mean, life happens.
Life happens.
Life happens to us, and I know just recently we've had some people that are in our support groups that are going through some really horrendous things, and one particular person messaged me, and they're just so disappointed in themselves, and I said, just please, just be kind to yourself, and don't worry about the numbers at the moment at all.
Yeah.
After this time is past, you can worry about that. Just worry about yourself. It's okay to just not even think about any of that. And we all have those times. Well, I think we do. I know I have.
I don't know anyone who does it. But that's where self-compassion, when I was talking about self-compassion work, I just think it's such a key thing here. I try to bring it in early.
Oh, I agree. I so agree with you. I never used to have it. I was cruel to myself.
Yeah, because you thought, it's motivating, that cruel side. It might make me move when I'm not doing it, but it just doesn't.
Yeah. Yeah.
Or it'll get you doing it for a little while, but then it always backfires. And it's never enough. Never enough because it's such a demanding advice. Where but self-compassion isn't, I'm letting myself off the hook method either. It's not going from one extreme, you could just do whatever you want, self-compassion. That's not what it's about. It's just acknowledging the difficulty of this and the struggle.
Yeah.
And that, everybody else, if they were doing this, would be struggling too. So, may I just be kind? But you know what? I might still have to do something.
Yeah.
But I'll do it in a shorter duration, or I'll do it less perfectly.
Yeah. Yeah, that's it.
Yeah. Yeah, have lots of that's probably my most common conversation is around that. To try and just get people to do little things consistently.
Yeah. Well, it's those little things. If we can just change just the little things, I've found personally that it adds up to a changed life. Just doing the little things.
You're more likely to keep doing the little things, but when you do big things, that's where we're back in that up and down and up and down. You're going to see more problems, and then that you feel so bad about it.
Yeah.
Because I haven't done, I said I was going to go to the gym 6 times a week. We're coming back to unrealistic goals. It's like, no, you're never going to fit that in.
Yeah, that's it. Maybe just that little walk.
Yeah, if you got a 10-minute walk that day, that's fantastic. And you went to the gym once. Let's just do that consistently.
Yeah.
So it's just shifting. It's very much shifting mindsets.
Yeah.
Yes.
I agree.
Yeah. I love you, like you said earlier about the it's not just sort of a tick and flick anymore. Seeing the psychologist, because we still have a lot of members that will, my surgeon's making me see a psychologist. What if they say no? What if? And I think sometimes people then look for surgeons that don't have a team because, it'll be easier to sneak through. And it's like, don't set yourself up for that, bad experience before you've even attempted it.
Yeah. That's really interesting feedback, because that just says there's still, if that view's still there, I wonder where it's coming from. I wonder in this day, like now, why is that still such a big view? Because in the American system, I think that it was such you had to see, whereas here it's not that. And there's 2 schools of thought: that everybody should see a psychologist, and others are saying, I don't think it's necessary for everybody. For some people, they actually know what know what to do. They don't have significant emotional, pretty well placed to have this not be too bad. experience, and whereas others, might already know that they have had issues early, mental health or, significant eating disorders or disordered eating, and would benefit maybe just from a so there's two schools of thought on it, and I think that's why surgeons also set up their practices slightly differently. And I often get asked, should everybody see a psychologist or not? In an ideal world, wouldn't that would be wonderful. But I'm a pragmatist, and there's not enough with experience in bariatrics, and that's such a must for psychologists in this area. I worry that, once again, if you don't know enough about bariatrics, and also you can't check your own views on what you think about the surgery, then we don't want to add another detrimental effect into somebody.
I totally agree with you. I mean, I am of the opinion that everybody should, because and I also understand what you're saying, that that we just don't have enough resources. I also understand that. I think for me, even if you are in a good place, even if you feel like you're in a good place, it's still wonderful to hear that, yes, I'm in a good place, from somebody who is able to make that assessment and say, yes, you're in a good place.
That's my point. Yeah, it's a good point too, because having said what I just said, also when people say they're in a good place, motivation is the strongest just prior to going through this process. Oh, of course, I'll do everything. I'm already doing this, or I know that I've got to do that, and I know I won't be able to eat as much as I'm eating because I've got the surgery. And every time I hear all of that, I'm like, I've done this for a long time, and I wouldn't have people coming back to me because that's that view that this is probably that's all I need. And yes, and like I said, motivation's huge in this early space, because I'm about to get this thing that I have been really waiting for.
I do wonder, because like we hear it on our pages as well, and I wonder if people sort of feel, if I go into this appointment highly motivated, then they'll tick the yes box. And
I think American research will show that out, and even some of the stuff that's coming out of England as well, because they've just done some surveys. Yes, there's that idea that if I say the right thing, then I'll get approved. Yeah. And obviously we've got some work to do to dispel that myth. But you two are running the pages, the groups, and you're hearing all of this. So do you have any suggestions? I'm going to interview you. Suggestions for us as psychologists to how do you think we can get the message out there that that's not what we do? We are not these gatekeepers assessing and preventing and putting back marks against your name.
I think if people were told that directly, straight up, this is not an assessment to approve or for weight loss surgery. This is to prepare you for it.
Okay. I think working in with I don't know if you do work in with the Weight Issues Network. I don't know.
I haven't got involved with it. I've met someone from it, and I know people that are involved with it. So I'm slowly, with my involvement with ANZOS and with ANZMOS in all of the roles that I've got at the moment. Yes, we are, and if so, conference coming up.
Yeah, and I feel like the more that people hear these sorts of conversations, the better that understanding is going to become, that they don't need to be afraid, and that this is an empowering type of a relationship that they can have. I think that really, and we all know that knowledge is power, and it's just a case of getting the message out. And whether there's more that can be done, more podcasts, more training, more working in with the networks of people who are very, very well placed to be able to speak with GPs, who are very well placed to be able to speak with all of the surgeons, to just underscore the vital importance.
Yeah.
Something that Tash and I talked about just after she'd had weight loss surgery and just after we'd sort of taken on the Bariatric Support Australia group. And we talked about how there's a need, we feel, for like a minimum standard of care for bariatric patients, so that they can look at it and go, this is the very minimum that I should expect from my team.
We wish, we hope that as we grow as a collective group, that we will be able to see those things put into place. That's what we hope, that we will be able to see things change so that every single person that has bariatric surgery does have the opportunity to have access to a wonderful psychologist that they can have to support them. We hope the same of dietitians, of exercise physiologists. These are the things that are needed in order for just to support the long-term health goals, the long-term awesome life that people are wanting to have. Nobody goes into bariatric surgery, like you've said, lightly or without having tried everything else first.
Exactly.
So from our perspective, I think that you're doing what you need to do. It's just more people need to hear it.